Hi, I'm Dr. Barry Gillespie. I have my practice in the King of Prussia Medical Center in King of Prussia, Pennsylvania, the United States of America. And today we're going to talk about CFT in the NICU. The NICU population, or the neonatal intensive care unit population, is a very special group of babies. And statistically in America, about 19 out of 20 births are normal and go well, and that 1 out of the 20, there's usually a problem, and that child needs a little extra care, and they go into the NICU. And these children are usually the preemies. They're born before 39 weeks, or they may have some difficulty. And in all honesty, it's some life-threatening issues are involved here. So it can be a very, very scary time. Just to relate my experience, my wife and I had my son Brian in May of 1975. And when we were in our 20s, and we thought, you just had babies. Our first baby was fine, and we just thought he had babies, and they came home and they were good to go. But with Brian, he had wet lung syndrome. And in 1975, the hospital we were in New Jersey didn't have a NICU. So as soon as he was born, my wife was holding him for a few minutes. The doctor came in and said, we got to take him to the NICU right away. And they took him in an ambulance to Newark, where the large hospital was at the time in the NICU. And he was in there for a week. And at that time in 1975, you weren't allowed to visit your child. So every day you would call up and say, how's Brian doing? And somebody would say, well, he's doing this, he's doing better. And so you couldn't even visit. So it was like 7 days of isolation. And in all honesty, it was a scary situation that, there's something wrong with your child, and you do a lot of praying and you hope everything is okay. So the NICU has a very, very special population, and the parents that go through it, there's a lot of emotions involved around this type of work. The craniosacral fascial system is a system I discovered about 20 years ago. And it's a system that involves the craniosacral system and the fascial web, the myofascial web. The craniosacral is where the brain, the cranium, actually has a very slow expansion, where it expands over a number of seconds, and it stops and it slows down, it contracts a number of seconds. And it's this expansion and contraction we call a brain cycle. And this is where the brain is breathing. The brain is slowly expanding, contracting like the lungs, and it's breathing. We have a toy that measures this, and I show this to the moms when they bring their children in. A lot of times the children will be very tight around their brains, and we have zero cycle and the brain's not breathing. And during therapy, there'll be slow expansion, there'll be slow relaxation where the brain starts to slowly expand and contract. And eventually, at the end of visits, the brain will fully expand about 100 seconds, and it'll fully contract to about 100 seconds. So we want a really nice brain cycle to be around 200 seconds. At the same time that the brain is expanding and contracting, the sacrum, or the tailbone, will gently flex and extend. So when the brain is expanding, the tailbone will gradually flex, and when the brain's contracting, the tailbone will extend. So it's this craniosacral action that will allow the brain and spinal cord to move and breathe. The other aspect of this system is the fascial web. The fascial web is connective tissue that attaches from head to toe, finger to finger. It's around every muscle cell, it goes into every organ, it's around the blood vessels, around the nerves. It allows us to be tensegrity, allows us to be upright, it allows us to be fully opened. It keeps us from collapsing, it keeps us from being jello. And it attaches from head to toe and finger to finger. And it goes into the eyes and the sinuses. And as long as it's loose, everything kind of works pretty well in the body. But during trauma, some of it can get tight. And when it gets tight, that's when we have problems. Whether restriction in one area of the body, the body gets tight, and you may feel pain or may feel tightness. And a lot of the parents will come in and say, gee, my child is just tight. So that is the craniosacral fascial system. There are a number of NICU conditions that we feel that CFT can be effective. The primary one would be neonatal abstinence syndrome, or working with drug withdrawal babies. And classically people think, well, mom was on cocaine or heroin, but this could be any medication that mom was on, oxytocin or any type of painkiller or just about any type of medication, that the child is getting that medication too, and all of a sudden when the child's born, the blood supply switch around, and all of a sudden that child has to withdraw. So that child is usually not very happy. So we feel that craniosacral fascial therapy can help relax this child, can help calm the child down, because a lot of these children are tight, where they're colicky, they're refluxy, they have the usual tightness thing that babies have, and on top of that, they're withdrawing from some pretty heavy drugs. So instead of being just the normal fussy, they're super normal fussy. And if you talk to NICU nurses, quite a few of those babies just scream all day. They're 24 hours. I mean, they'll stop screaming when they go to sleep, but they're very unhappy, they're very restless, and we feel that CFT can help relax them and help calm them down. So we feel that over a series of visits, these babies will feel much better more quickly, and they'll heal faster. Classically, these babies stay in the hospital for 16 days on average. We feel that with CFT, we can relax these babies and get them out in at least half the time. So we feel that can be possibly very, very effective for NAS, and we'd love to do research in this area, hospital research, to prove this point. There's some other conditions we feel CFT may be effective. And one of the diseases is necrotizing enterocolitis, or NEC. And this is a disease, it's a pretty serious disease, life-threatening, where we believe there's fascial strain down in the mesentery of the intestine. And this tightness in the mesentery of the intestine can possibly cut off the blood supply to the intestine, the arterial and venous supply. It can possibly cut off the lymph drainage, the drainage from the toxins coming back from that organ. And we feel that it could be possible that this tightness can create the necrotizing colitis effect, where it can be a very, very life-threatening situation. There's another situation, condition in the NICU, bronchopulmonary dysplasia, or BPD, where we feel that there's a lot of restriction around the lungs, that the fascia and the respiratory system is tight. And once this tightness is freed up, the baby can breathe better. And there's a third situation that's called retinopathy of prematurity. It's ROP. And what we feel is that there may be fascial strain within the eye of the baby. There's a vitreous matrix in the eye, all over our eyes. It's like a fascial web inside the eyeball. And this vitreous matrix can attach to the retina. And we feel if there's strain in this fascia within the eyeball, that strain can possibly pull the retina off of the eye socket and can cause blindness. And in America, about 500 babies a year go blind because of ROP. And we feel that craniosacral fascial therapy may have an application where we can help save the sight for some of these babies. In 2012, we were fortunate enough to teach a NICU nurse, and she was from the Rocky Mountain area, and she practiced in a small community hospital. And her neonatologist was gracious enough to say, hey, go take this seminar and come back and we'll see how it works. And she learned over a period of, during our seminars, and she went back into the NICU, and she was relating to me over the months what she was finding. And one particular case she had mentioned was that a child suddenly developed NEC. It was getting all the 5 symptoms of NEC, necrotizing enterocolitis, and once that happens, it becomes a life-threatening event. And my students decided to say, let me do some CFT on this child very, very quickly, and she had her partner there, and the two of them were doing CFT. And within 10 minutes, all of these symptoms were gone. And she felt that, wow, that neck might be disease of tightness. The child was getting lumpy in the intestinal area. There was a lot of discoloration. There was a lot of bloating. The child wouldn't eat. These are symptoms of neck. And within a few minutes, they all went away. And the child had a normal bowel movement, and everything was fine thereafter. So I got very, very excited about it, and I studied neck on the internet, and it looks like there may be a strong application there. She was also finding they were working with the NAS babies, the drug withdrawal babies, and she was telling us, she and her partner were telling us that quite a few of these babies were doing much, much better, and they got out of the hospital that much faster. So we feel that there's maybe a strong implication for the NAS babies. So we do have some history, but we'd love to be able to do some research in hospital works in the NICU, and we have a strong feeling that once our work starts to relax these babies, calm these babies down, get them happier, they can heal quicker and get out of the hospital sooner. If I ruled the world, every newborn would have this work done at their birth. And specifically in the hospital work, what we'd like to do is to have the babies checked with a baby brain score. If the baby brain score isn't up to speed, we would do CFT right at birth. So ultimately, I understand with babies going to the NICU that they're very unstable, and this may not be able to happen for those babies. But the ultimate goal for the NICU baby, as soon as they're stable, as soon as the contraindications go away, and we'd love to have the brain breathing, the cerebral spinal fluid flowing really well, the fascia really relaxed. We really like to have all of these babies in the NICU really happy, really calm, really relaxed, so they can heal. I mean, a lot of them are difficult situations, a lot of preemies, 24-weekers. It's a life and death situation, and if possible, we'd like to make our contribution to keep the child as loose and calm and free as possible. So we see this at birth. That would be our ultimate goal. Thank you.